Hey, everybody. My name's Mitch Stripling. I'm the director of the New York City Preparedness and Recovery Institute, which is operated at Columbia University with our key partner, the City University of New York Graduate School of Health and Health Policy. I'm so excited to get to welcome you here today for the third in our Resilient Futures series. This series is looking at the intersection between climate change impacts and public health. It's a really rich, deep area with a lot of priorities and relevance to today and the crises that we see happening both in this country, in the United States, and around the world. Today, we're talking about one of the most important elements of that to me, which is communications. You know, for me, it's getting harder and harder to communicate about these issues out in the world in any way that makes change. It feels stuck, like there's a crisis that's clearly happening, but somehow, for some reason, we can't convince people that it's a crisis. We can't get the world to stand up and take action. How do we change that? How do we communicate in more powerful ways that can lead to positive outcomes for everyone? It's a key issue that keeps me up at night, and I'm grateful that we have such a great panel of experts with us today to talk about it. I'm going to introduce them briefly and then hand it off to our moderator. First, I just want to introduce Julian Watkins, who's been our companion on this entire journey, the Assistant Commissioner of the Bureau of Health Equity Capacity Building at the New York City Health Department, who sort of spearheaded and was the thought leader behind this initiative. Julian is a real equity leader in New York City. He leads initiatives to advance community wellness and reduce health inequities of all kinds through engagement, storytelling, community-driven programs. As a physician, he really has the well-being of the whole New York City community at heart. So we're grateful he's been our partner throughout this and that he's joining us today. We also have Neil Lewis Jr. on, who's an associate professor from Cornell University. Neil is a behavioral scientist. To me, this is one of the key specialties that we need in public health communication. How do we help people to change their social behavior? He's actually written a textbook on social psychology around these issues. He's a contributor to The Atlantic. He works with researchers, with policymakers, communities of all kinds to find ways to address social challenges through behavioral science. It's an important and I think really understudied area. So I'm grateful to have his wisdom and insight in for this conversation. I'm also excited to introduce Surili Patel, who is the Vice President and Environmental Health Lead at Metropolitan Group, which is a communications and strategy firm, which puts her squarely in the middle of this Venn diagram of communications and climate science. She was formerly a leader at the American Public Health Association, where she drove national initiatives on climate, health, and equity. She's a recipient of the HHS Green Champion Award for Climate Resilience and is a great voice in the area of coalition building around these issues. So thank you, Surili, for joining us too. And then last but not least, I'm glad to introduce our moderator, Brian Pavlonis, who's an associate professor at the CUNY Graduate School of Public Health and Health Policy, our key partner in PRI. He's a certified industrial hygienist who's often worked deeply at the intersection of occupational health and climate change, for instance, through a focus on heat, illness. He directs the Industrial Hygiene Program for the NIOSH Education and Research Center in New York and New Jersey, and has focused in his research on environmental exposures and health risks in underserved communities. Great voice to speak to these issues. So Brian, thanks to you in particular for moderating this this morning, and over to you for some opening remarks.
Great. Thank you so much, Mitch. It's a pleasure to be here. I'm super excited to moderate this panel with such experts. And before we begin, I want to go over just a brief presentation about our work at the PRI when we did a special issue for the Journal of Health Communications. Now, as Mitch had mentioned, I'm an industrial hygienist by training, and I guess for those unfamiliar with that, it's really about quantifying exposure in just different environments, whether it be home, work, commuting, etc. So I come to this from much more of a quantitative lens, and helping guests edit this journal just really opened my eyes to how important it is to have a communication strategy, how important it is to partner with the individuals on this call with us today. Uh, because without an effective communication strategy, we really cannot achieve our goals. Um, and I think this special issue really kind of serves as a playbook for state and local health officials to use that really outlines, the barriers, the challenges with climate change communication, but also some evidence-based strategies to try to tackle all the misinformation that is being propagated in social media or other avenues. So this was released in 2024. Again, it's the Journal of Health Communications. For this, we got 8 tremendous original research studies, and anything from effective health messaging at the state and local level to really how to manage climate communications. And it includes both results from international work to anything down to your local health department. So I'm going to kind of walk you through just a couple of studies from this to really kind of, again, help set the stage for our discussion today. And then, for everyone on the call, like I said, this is all open access. Everyone, could, download these articles and kind of see what's out in the literature, what's been effective and what hasn't been. And the first one I want to talk about is one I was fortunate enough to edit. And this came from basically a discussion with 26 state health officials throughout the US. They were in every geographical region throughout the US, kind of spanned every political spectrum, and really, was about, how can we tackle misinformation about climate change and devise an effective strategy in terms of communications. And and I'm sure I really would love to hear from all the moderators of this call about their opinions on this issue. I think for me, it left me both enthusiastic, but also struggling to grapple with just the overall magnitude of what state health officials are facing. And I think everyone on the call is, part of some sort of state or local health department, either with New York City or New York State. And, as scientists, we're just not built for communications. Through my undergrad, graduate, postdoc, I never had a course in communications. The CUNY School of Public Health, this is definitely something we're focused on, and we have focus areas and degrees. But, a lot of people working in these jobs just don't, again, have that type of training. So it is so much harder, and I'm sure you all know this, to deliver facts and messaging that resonates as opposed to someone out there, working on solely emotion and, having bad faith arguments. So how do you deal with that effectively? And the author of this paper, I think, came up with 2 great strategies. And again, I'm so excited to learn from the experts on this call of what they think is most effective. But the author of this came up with 2 strategies, and the first one was a delayed response. So I don't know if anyone on this call has ever maybe engaged in a social media argument, but obviously tempers can flare up. It becomes very heated. It often, goes into the personal realm, etc. So instead of immediately engaging with misinformation, sometimes it's better to wait and avoid the amplification, avoid, the kind of pile on from other outside entities as well, and just, let it sit for a while, This both reduces the conflict and also allows you to, think through and control the narrative. So instead of immediately responding, again, waiting, get back, control the narrative, and, have a strategic messaging in there. And this comes from a state health director. One communication director said he tracks misinformation posts through social media. If the post doesn't gain much attention, then it's not even worth even getting into some sort of battle about. If it does start to get more attention, then they can, quietly correct the record without stoking backlash with an immediate response. Another, I think, really good effective strategy was something called social media listening. And again, it's not about engaging. It's not about engaging in bad faith arguments. It's about listening to what's out there on social media, what's being posted to maybe your health department social media account, not really responding, but collecting that information, and then, trying to have information sessions that, while not responding to that initial post, kind of, brings out broad information to the wider audience. Maybe responding with infographics, facts, as opposed to, again, directly engaging with that discourse. I guess what left me somewhat, I don't know, maybe scared for the future is just the scope of the problem. I mean, again, you have hundreds, if not thousands, health departments throughout the US. All are understaffed, limited resources. We don't have a lot of training in this. So the scope of the problem is just infinite. But we do need to learn to engage and use social media effectively, because that is where a lot of this misinformation is being spread. So, we have to take the good with the bad and, have meetings like this and come up with good strategies for engagement on social media. And, again, as part of those messaging strategies, we have to find the right balance. So these were two articles from the special issue, kind of talking about the right balance with fear and anxiety. Of course, that can be a good thing, but too much of it obviously is a bad thing. So what one of the authors found is that there's this curvilinear relationship between fear, anxiety, and action. So, basically a little bit of fear does lead to action, but too much fear obviously then can have a person shut down. Okay, they get to a point where they feel they can't do anything. So again, why fear and anxiety can be a good thing. Too much alarmism without any solutions that people can do really does nothing. It's ineffective and it leads people to shut down. So, your messaging should be fact-based, but it also should incorporate things that individuals can do that can empower them to take actions and make modifications to their life. And then finally, from these two studies, I think the big takeaway message again, fear alone is not enough. You need to, obviously use that fear, but give people solutions, things they can do, give them agency to make informed choices. And, those combinations of both fear and solutions-oriented messaging can spur about the most amount of change. And another big, I think, takeaway message from this special issue was tailored messaging are the most impactful. So, obviously climate change, all the things that occur with climate change is a worldwide phenomenon. But unless we do a really good job of bringing it back home, that messaging could be somewhat ineffective. Okay. And you need to really consider the audience you're speaking to. Anything from political ideology to prior beliefs, their emotional readiness, etc. But all these things need to be taken into consideration, and your messaging also needs to be balanced. So again, we're going to now open up to the rest of the panel. I want to thank everyone for joining us, and I think we're going to have a great and lively discussion today. Great. So my first question is to Neil, and this is all about public perceptions. So how do public perceptions and misinformation about climate change influence attitudes and limit effective action, particularly in public health contexts?
So, as I've been thinking about this and doing research in this space, there are a few key things I think that are important to know and for us to talk about in this conversation. One is there's actually a lot of misperceptions about the levels of concerns about climate change and a variety of other health issues, as well as misperceptions about who is concerned. So, in the research that we've done on this over the years, we keep finding that Americans broadly underestimate the amount that other people are concerned. So people are more concerned than Americans think they are. So that's one thing to know. And that's true about climate change. It's true about other environmental issues. And it's also true about a number of health issues that we can talk about as well. The other key thing I think among that pattern of misperception is Americans especially underestimate how concerned low-income people and people of color are about these issues. And those misperceptions, I think, have a number of important consequences for what we're talking about today. One of those consequences is that the misperceptions often lead us to be less willing to engage with the very communities that are most willing to do the work to address these issues. And so that creates a number of collective action problems, right? We find this when we look in the climate and environmental realm. We find this in some of our health work. This is this broader pattern that there's this misperception about who is and is not concerned. And part of that's driven by media narratives, it seems. Lack of representation in climate communication is one of the things that contributes to these misperceptions. But more broadly, one, I think, hopeful thing to know is there are more people concerned than you might realize. The other quick thing I'll say, sort of connecting those 2 points around misperceptions on environmental issues as well as public health is in the sort of scholarly discussions, we often separate climate and environmental issues from other public health issues. But that's not the way that everyday people are often thinking about these, especially in the work that we've done that's focused on low-income people and communities of color. We find that they're often thinking about these issues as interconnected, which of course we know they are in the world. But talking about these connections between climate and health and environment and health, those are things that resonate more broadly to many different people. And for me, that is an important insight for the opportunities that exist for building more diverse coalitions to address these issues.
Oh, that's fascinating. I wonder if I could ask a follow-up question real quick. Uh, you had said in your opening discussion that um, I guess messaging or yeah, I guess the messaging isn't really, uh, people feel like they should ignore lower income or people of color because that messaging's not going to resonate with them. I guess who are you referring to? Is it academics that are ignoring that? Health departments? I'm just curious about that.
Yeah, so the research that I'm talking about is public opinion research, asking representative samples of the American public about who they think is concerned, and the nature of those concerns. And what we find over and over again is, the American public across the board is underestimating the concerns of people of color and low-income people. So that's the distinction there. So we haven't focused on health departments in particular, but this is broader public opinion research.
Interesting. Thank you.
Thank you.
Let's see. And we're going to move it on to Cirilli. So the question to Cirilli is, how can climate change messaging be effectively integrated into public health campaigns and community-based programs to maximize their reach and impact?
Yeah, this is a great question. And before I get started, thank you for having me. I'm excited to be here and share what little I know. I'd like to start with the fact that, and acknowledge that people receive a ton of information every single day. I think it's like 105,000 words per day, 23 words per second, and on and on. And it's coming at them from multiple places. And we've learned that our limbic system can process information so much faster than our cognitive system. So our first response to new information is how we feel about it, how it feels inside, rather than what we think about it. So in this space of selective attention, I think a way to maximize reach and impact is to frame the message, the issue, in a way that connects to your audience's values. So one of the things is, knowing that it's essential that messaging is framed with the audience in mind, using values-based messaging. Through some of the research that we've done here at Metropolitan Group, we found there's 3 values that resonate across the ideological and socioeconomic spectrum when it comes to talking about climate, health, and equity particularly. And those 3 values are prosperity, safety, and health. We tested equity, and it didn't test well for obvious reasons across the spectrum, but when paired with health equity, those two, that term together makes a lot of sense and resonates with a lot of people. The other thing that I would say is you got to name it for what it is. And sometimes people who are disproportionately impacted are disproportionately impacted because of environmental injustices or structures or systems like structural racism that are causing disadvantages. I don't say, come out with this messaging, but if your audience is ready to hear it, naming what is underlying the health impacts or the climate or environmental devastation, it's really important for them to hear. And if they're not, that's totally fine. I recommend trying to define it, use examples and stories to demonstrate what that would look like, and then say, and what I just described is, and name it. When we're talking about health and health equity in particular, it's one thing to say, generalizing that young people are more vulnerable because they're dependent on their grown-up. But when you're using examples like populations, let's just go with the young people example, it's important to connect it back to the climate implications. So young people are more susceptible to heat exhaustion because their bodies and systems are still developing. They take in more air and water per body unit than the adults. So they're not just tiny versions of adults. And really connecting and honing in on what is it that connects the person, the population, the health impact to the actual climate event that you're speaking about. And I guess the last thing I will say is there's some links that we can drop in to share a little bit more about some of the research we've done around climate, health, and equity messaging, but also around structural racism and health messaging.
Great. Yeah, I was wondering if you could maybe give like a concrete example of some work you've done or colleagues or you just know of that has been great and effective messaging, and maybe a campaign that unfortunately did not resonate with the public. So we can kind of maybe learn the differences.
Yeah, let me start with what didn't work. Because, we're, as human beings, very good often at pointing out flaws. We, while I was at American Public Health Association, we wanted to define the field of environmental health and who works on environmental health. And through a ton of public polling, focus groups, et cetera, we came to the conclusion with our partners that the airport ground crew was a really good metaphor for starting off the messaging. Whereas there are some environmental health experts who are visible, like the pilot and the flight attendant. And there are others that are not visible, but they still need to do the work to keep the plane and the flight and the airports running, like the people who move your baggage to the bottom of the airport and back to the conveyor belt. That tested really well when talking about climate change, when talking about natural disasters, but also when talking about like the built environment and adaptation strategies. Where it didn't take off was many of the environmental health practitioners didn't want to be associated with the airport ground crew. So I would say that was a huge lesson learned, because it was, while it resonated with the public, the users, the messengers weren't convinced that that was the messaging that could take away some of the mystery behind the field of environmental health. On the flip side, I've worked with a few organizations, grassroots organizations, who have applied this climate, health, and equity message framework to some of their local campaigns. For example, one in Massachusetts, they used some of the language, particularly around health equity and safety, those two values, to demonstrate why a community solar plan was the direction they want to go in. And they offered comments to their city officials. And so one of the examples from that was that the air quality would improve because they're using more solar, and therefore children can go out and play, and they use student athletes as an example. And that piece of policy did pass in their town.
That's great and wonderful. Thank you for those two examples. I guess another question I had, and and anyone in this group, please respond, is it sounded like you were talking at the very macro level, like anyone from more of a statewide initiative or a very large, I guess national campaign. Maybe more at the micro level, like we're talking, maybe a really a small health department, a community health department. How could they, have effective messaging when they don't really have those types of resources? How could they maybe, I don't know, design a campaign, or maybe even just respond to social media? I don't know if you were listening to some of the research that I presented, but what kind of, I guess, strategies would you give to them?
I can start and then pass it off to my co-panelists. When it comes to the hyper macro level, my advice to community level organizations or even health departments is really looking at your own capacity to respond and really examining where your audience is. Like you were mentioning, Brian, in your research, that sometimes trolling happens, right? But if it's not getting anywhere, don't respond. Other times, I recommend having a crisis communications plan, or at least like some kind of decision tree out there, so you can quickly assess, is this worth us addressing? And do we do it now? Or do we sit on it and watch and let it develop? or just say, hey, maybe this is not us, maybe it's our partner speaking out on behalf of us. And so having some kind of decision tree, who's involved, who gets to be part of that decision making and triage based on, those are just 3 examples, and every community organization operates differently. So you might have other scenarios you want to include. But that's how I would recommend at a super micro level trying to respond to a specific, social media comment or even questions at the hyper local level. As far as producing a campaign and delivering it, again, really the most effective ones I've seen have happened in coalition. So it's not just your organization, but it's your partners that work together to build off of one another's strengths. And so you're not relying only on your organization or your agency's capacity to make sure you are as effective and hit all the channels that you'd like to hit, and make sure you reach the audiences where they are.
That's great advice. Yeah, I know from going and editing that issue, that was another thing that was mentioned, is really the coalition building. It really shouldn't be on just one specific agency, but rely on your trusted partners to do exactly what you said, triage that messaging, because somebody else may be a more effective partner for that communication than you as a health department. Did anyone else want to weigh in?
Julian, did you want to go first?
Yeah, I can hop on. And let me, is my audio okay? Sounds like it's a delay.
No, it's working.
Okay, yeah, thanks. What I would add is, no matter where we start, a lot of this work has been done, has been done for us. There's a lot of groups out there that have done a lot of work to really frame where to start. We're not starting from scratch on all of this. There's a lot of great, academic institutions, neighborhood, community institutions, even faith institutions who have already started a lot of this work. And it's, we're at a point now where it's kind of picking where your starting point is and building on what others have brought together using evidence, versus feeling as if we all have to, start from square one. We're starting from our square one, but I think where the conversation is, where the evidence is definitely not there. And we've actually advanced a lot within the last few years, especially in terms of the types of communication tactics that we have used and tested in communities, specifically around the last couple public health emergencies, from COVID to mpox and all of these other things. There's been a lot of expansion in how we're approaching communications and how we're having conversations, that may be politicized or just maybe political by their nature, but politicized, polarized, and partisan. We have a lot of research on how we can change hearts and minds and really address some of these complex, beliefs and other barriers that may get in the way. And I think with climate change, it's pretty much, we're building on all of that we have been doing. And a lot of the skills for communication are very applicable for this issue and problem. And we're just at a place now where it's really just figuring out where to start, understanding that every jurisdiction and your needs and who your partners are, who the trusted messengers are, may be different, but just understanding that at some point, at local health departments or small community org, is deciding which bit of this we want to, what is our access point.
Talked a lot about
Neil, you're on
social
mute.
media. Can you hear me now? Yeah, okay. One thing I'll quickly add is, so far we've been focused on social media, but I want us to broaden beyond that and remember the other channels that we have for communicating with people. So we do a lot of research on local news, for instance, and that is a place that health departments can have experts go and share messages. People still trust local news a lot for getting, especially health information. So using that as an opportunity to share these messages is something that we should be thinking about. as well as the face-to-face, right? I know that that's a harder lift, but taking time to have deeper conversations with people about these issues, that goes a long way. One of the big problems in the space is there are not enough conversations about these topics. And, seeing a tweet about something is not going to necessarily convey all the information needs to be conveyed. You may not be able to answer all the questions that people have, but sitting down for a conversation or a town hall or something like that gives people other ways of engaging. And I just want us to remember those strategies as well, rather than all social media, which I do think is social media is important, but we shouldn't forget all of the other things that we have at our disposal.
Yeah, I think that's a wonderful point, and obviously, I think local news is still highly trusted. It kind of goes back to our framing session of when it impacts an individual, it resonates much more. I had a quick question for the whole group. I can understand and kind of wrap my head around how message is focus tested, um, and whether or not it's effective that framework. But when you actually then start to do a campaign, how do you measure a campaign's effectiveness? How do you know if it's working or not, et cetera? What kind of metrics do you use?
I can start and speak from the NYC perspective at the health department here in the city. It really, the metrics all depend on the goals of the campaign and what we're trying to accomplish. When we think about messaging towards someone taking an action or making a health decision, such as vaccination or getting treatment, etc., the success of a campaign can just be around number of folks vaccinated or traffic, foot traffic in a place, etc. But when we think about issues such as climate change, if we want to get more micro and zoomed in, it's really understanding what is the particular message and what are we trying to accomplish, and really bite sizing, making it in bite-sized bits, or like right sizing the message. If we're thinking, for example, for like today in New York City, there's some air quality issues with the wildfires that are happening in Canada, and for us, a successful campaign can just be sensitizing folks and raising a general level of awareness, and just making sure that an increased number of eyes, get this important public health information. So we can look at various different ways, but one of our goals, a goal of some of our messaging can literally just be, in a core tenet of public health, is educating people and raising awareness and helping people to understand that something may be presenting a threat, to their public health or the broader public health of a community. So we could look many different ways, but the key for folks who are, moving into the messaging space, communication space, at this point maybe new to it, is to really it takes thinking about the goals and setting realistic goals from even before you're crafting messages, so you can set reasonable outcomes and success rates. Like, we're not going to get everyone to change their mind on climate change globally, but we can get folks to take different actions or think differently or consider different things, depending on what the issue is that we want to raise.
So I'd like to jump in here, because I think what Julian just said is not only really important, but when you're applying it from traditional health metrics to climate change, we might actually have to think about measurements differently. And I'll use examples going from COVID, where, as Julian mentioned, many health departments and governments measured success by the number of shots in arms. Like, that's a easily countable thing that you can use to measure success. One thing I've been thinking about with the climate and health work, though, success to me is preventing bad things from happening, right? So it's It's not counting shots in arms. It's finding ways to figure out. So, thinking about even the air quality example that Julie talked about, the air quality issue here in New York. Um, what are ways of preventing people from ending up in the hospital, from preventing people from having other long-term issues? Like those are counting the prevention can sometimes be harder than counting treatment afterwards. But those are things we're going to have to really get serious about if we want to figure out um, what we should be doing, and then how to know if whether the things we're doing are working. Because, yeah, just waiting until everything is bad and then counting how we're treating people afterwards, I think that would be a really negative outcome for all of us.
Yeah, I really liked what you said, Dr. Lewis. In terms of we are, as public health professionals, we are working in the prevention space, and so it is hard to measure. And oftentimes, there are different types of campaigns, right? So oftentimes they're short. Let's make people aware that the air quality is poor. Just keeping with that example. Sometimes it's more about climate change affects health, and this is how. And that's a longer term campaign, messaging campaign. And so there's going to be multiple strategies. Some in the immediate you can measure by seeing what didn't happen, right? Last year there were this many hospitalizations because of dehydration. And this year there's less because of our it's not a one-to-one, but you could attribute some of that success to the messaging campaign. But the longer term shift in the way our culture, our society, our communities understand the connection to climate and health, that's the long game, and that's a little bit harder to measure.
Yeah, as you were talking, I was, thinking about that. I mean, it seems like you have two distinct types of messaging. I mean, we have these acute effects like, heat stroke, asthma from wildfire smoke, et cetera, that you get the message around. But then also, obviously, climate change is a long-term type problem. So, from your experience, how do you, I guess, message these two different, I guess, types of events? One that could happen tomorrow, and then one that's going to occur gradually over the next 20 years.
Can I start by sharing one thing that is similar in both? Sure. Which is the call to action, is what we call in CommSpeak, right? So what do you want people to do with that information? In the, acute respiratory illness attribution, you want people to be more aware and alert, maybe carry their inhaler, shorten their time outdoors, et cetera, right? And that's their call to action. In the long game, the call to action still has to be urgent and relatable. So I think, I don't remember which one of you said this, but you got to break it up into smaller pieces. And that's where you can see more action, more people taking on and understanding what you're trying to message because they're doing what you're asking them to do. That has resonated with them enough to take action, enough to not just keep behaving the way they have been behaving.
And if I could just pause for a second, I just want to remind everyone that's on the call, if you could kindly please post questions in the chat box. Following this, we're going to have a quick question and answer. So please post all questions in there. I apologize if anyone else has anything.
The other thing I'll quickly add here is, regardless of what time scale we're talking about, this connects to something that came up earlier, that connecting the dots for people is going to be really important. You can't assume that if you know, say that climate change is happening, people will necessarily know what the concrete manifestations are in their area. But if you, as part of your messaging, take the time to connect those dots, that can help people understand what's happening, and then also know what they might be able to do about it, to the point on call to action. And this is true in the climate realm. It's also true in many other health realms. So we've been doing some work. So we had published some research earlier this year, for instance, around this with helping people understand why there were COVID-19 disparities. And when you connect those dots, it helps people. It helped people understand why the disparities were happening, but also motivated them to do something about it. They didn't understand the connection. That it was less clear why they should do anything. Similarly, we had another paper out earlier this year connecting um, sort of disparities in sort of childhood related outcomes to things like the child tax credit. Connecting those dots, connecting with these sort of shared values that we talked about earlier, those things were motivating for people, right? But we live in this really complex world where lots of things are happening, and it's not always clear how they're related. And if it's unclear why something's happening um, or what any action might do, then there's no reason for people to do anything, right? From a motivational perspective, like people need to know why they're going to be taking a particular action and why their actions might end up having some impact. But they're busy. They're doing, they're working. They're trying to take care of their families and the like. So it's not the case that they're going to necessarily go out of their way to try and find the ways to connect all those dots. That's something we who are developing messages and testing them, we can do that, and that will help you.
Fantastic. And I see Julian dropped off, but this next question I was going to pose to him, but I think everyone in the group. Oh, I see he's back on. Julian, can you hear me?
Again, apologies, working behind the city firewall. I hear you, Brett.
So my apologies for that. And this kind of builds off with what both Cerulli was saying and Neil. How do you, I guess, at the health department, really have messaging that's both compelling and inclusive in terms of your climate communications?
Thanks for the question. We really use an evidence-based approach to our communications. And again, my bureau, my team, we're in the Center for Health Equity. So we do not lead the communication strategy for the entire agency, nor are we weighing in on or kind of developing the communication for every health topic. But specifically and strategically, we have leaned into and have embraced climate change specifically as not only a public health issue, but as a health equity issue. And in doing so, it's really helped us understand and normalize this idea that there are many climate messages that we need to deliver, and that there are many different communities that may be at different paths in their journey or awareness of climate change as a public health issue, but also the way that climate change may show up in their lives. And so one of the really helpful tools that I found that we found helpful in the COVID response and impact response and all of our responses is really understanding this concept of the voice, and understanding who are the communities that we're thinking about. We often think about communities, these regional things, or we think about communities as organized around race or ethnicity or gender identity. But a lot of these communities are not, people are not naturally kind of organizing themselves in this way, and there's a lot of overlap in communities. And so really looking at beliefs can be helpful to kind of cross-cut some of these things that are uniting folks. And so we did this, similarities beyond just racial similarities or ethnic, etc. But what I found is in the Climate Communication Institute or program at Yale, for the last 10 years or 11 now, they've been tracking, what they've called the Global Warming 6 Americas, just tracking where beliefs are and where people are on the spectrum, from people who are alarmed and are thinking about climate change and see it as an issue, to people all the way across the spectrum, from concerned to cautious to doubtful and disengaged and finally dismissive. and just tracking where that goes and understanding that you may see people on a spectrum, and that some people they may be somewhere on a spectrum that you may not associate with someone based on how you see them. So it's really about deep engagement and building out our capacity to tailor our messaging. A reference that was shared in the chat comes from the Harvard group that does a lot of climate communication. And there's and the link that we shared in the chat with the 10 research-backed tips for climate communication really help lay out ways to be thinking about this and ways that can really help expand and I really elevate the ways that we are communicating with people. And some of the main takeaways from that are really to encourage folks to harness emotion. Some communities respond more to an emotional response, or respond better to a story than just hearing hard data and hard facts being presented. Really thinking about ways that we can lean into trusted messengers. Folks may be more willing or open to listening to someone if they feel a shared background, etc. And then just other techniques to be more visual versus data oriented, to really understand and think about the fact that some people aren't making decisions as individuals, but more so as members of communities, or and see themselves in this kind of as part of something bigger, as a larger context, and may need to understand that many people are doing this, and that people like you are doing this, NRK, or sometimes that's the strategy too. So it's really about taking an evidence-based approach to really open up and expand how we understand who we're engaging with, to really have more detail for ourselves, for the communities that we're engaging with at any given time, understanding that we can't paint with these broad strokes to really capture what's going on in people's lives and how they show up, or how they're understanding climate change as a public health issue.
So it seems like I'm definitely not a communications expert, and I appreciate this discussion we're having. Again, when I was editing that journal, that seemed to be a big takeaway, and something that you just described. You have to give people something that they can take action upon. Otherwise, fear alone just doesn't do it. I was wondering if you could give me a good example of something that you have your messaging, but then you have the action step. What are the actions that you're recommending?
Broke up a little bit at the end. But I think an example is around climate.
Yeah, I guess I was curious about what are the action
Sorry,
steps. So when you do your messaging, obviously you want someone to take action. What are those action items?
Yeah, so the action item may be, checking the air quality index daily. Just reminding folks that there's an index and information, that is on your weather app, that you also see on your local news, to just check, especially if you are, a person or someone in your household or community is at higher risk for, air quality events. If you're a young person with asthma or an older person with a chronic, lung disease, encouraging folks to check these tools and reminding folks of the tools available. It may be an action step such as that. Or maybe if you need to go to a cool center, if you're, on a really hot day in New York City, on hot days and these prolonged high temperature periods, we're seeing, in every year we see, through 400 to 500 people die in New York City. So just raising an awareness that on the really hot days, if your AC's out, or if something's, there's a disruption, to help folks know that there are cooling centers, and to encourage folks to either find one that's in the area during the event, or to prepare ahead of an event to know where the local places are. So those are some of the concrete examples beyond getting a shot, etc. It's really just around raising awareness. Some activities, encouraging folks to stay at home. If there is a heat, if there is a air quality alert, etc. It can be, as we can break it down as just a simple, we need you to do this action, or it can be this kind of bigger awareness, like, here's a new public health threat that we are going to explain to you. If we're thinking about something, beyond like climate, but something around, like long COVID or something that may be brand new to people, or that we may need to really help build out more structure and context for what we're talking about to raise awareness around an issue.
So if I can quickly build on that, from the broader behavior change literature, 2 to 3 recommendations is sort of the sweet spot, right? One's not enough, four is too many, four or more is way too many. 2 to 3 seems to be the sweet spot. And so, given that, what I would encourage sort of health departments to do is to think about, for each of these issues, what are the 2 to 3 things that you would want people to do? So, Julian mentioned with air quality, one thing people might do is just check the weather app every day. Another thing might be keeping masks. Yes, K95s have another purpose too. Keeping masks in your bag so that on those days that if you do have to go outside, you have them with you. Maybe for heat related issues, there's a different set of 2 to 3 recommendations, the cooling centers or something else. But it would be useful for departments to sit down and do their planning and think about, for each of these ways that climate change might manifest in your local environment, what are the 2 to 3 things that you want people to do? And then share information about that.
Great. So I think we've concluded with the panel discussion, unless anyone wants to jump in. Uh, but if we're okay, I think we can move on to questions from the audience. And our first question is from Rachel Thompson. I'll just read it for everyone. How do we keep climate action a high priority among the public in light of many immediate crises competing for our attention? Anything from immigration, poverty, authoritarianism, conflict.
So maybe I'll jump in here because we have some data that speaks to this directly. So one important thing to know, and I touched on this a little bit at the beginning, but I'll reiterate it here. One important thing to know is that in people's minds, these are not necessarily separate issues, right? That the data that we've collected suggests that there are many people who are thinking about these in integrated ways. So specifically, so one of the things that was in the question was poverty, for instance. Poverty is one of the issues that in our public opinion research about this, people talk about as an environmental issue. So I don't think we need to be thinking in this competitive framing kind of way. It's not climate change or, I think it's climate change and there are ways of integrating those messages that would be broadly resonant. Similarly, I think one of the other examples in that question was immigration. Well, we know that climate change will drive a lot of migration, and because of places becoming less inhabitable. And so there are ways I think that we can talk about these things together. It's not an either or in my mind.
Maybe if I could pose a question about, just jump upon that. As we've seen in the last few days, with the immigration raids that are going on across the country. One thing that kind of jumped into my mind is many of those individuals are working in jobs that have high heat stress. They're more vulnerable to climate change, etc. I guess just your overall, reaction of how do we continue to work as public health practitioners and ensure a health and safe workplace for these individuals in this climate where there's a lot of, fear around?
I don't have a full
I
answer
think
to this because this is new territory. Sorry, Dr. Watkins. Is that we've learned that belonging is a really fundamental feeling and value people have. And in the workplace, you know, having community, building community, and that sense of relatability is often helpful. There's also the principles of in-group and out-group thinking, and the more we can demonstrate that there are, you know, more people who are understanding, who are coming together on similar issues, and ultimately holding our decision makers accountable for, the work that they're supposed to be doing to protect and safeguard our communities is part of that coalition community building.
Julian, did you have a follow-up? If not, I can jump in.
I'll leave it there. You can go ahead.
So, building on what's really just said, I'm thinking back to COVID times and some of the lessons we learned there that I think are relevant for us to be thinking about again. So you might remember that during the pandemic, there were these discussions about the missing workforce and how that contributed to, price increases and all these other negative outcomes in the society. And when researchers looked into that, one of the things that was clear was, well, the communities that we let die at disproportionate rates um, were a big chunk of um, that missing labor force that we are all ended up suffering from, right? And so I think these are things that we need to remember, that all of our lives are interconnected in these ways. And so how we are treating people um, and their ability to, live healthy and prosperous lives or not, based on the decisions that we're making, that's matters not only for those individuals, it matters for all of us. And so I think those are things that we should be keeping in mind as we follow what's going on in California and elsewhere.
Yeah, I think that's a great point. I mean, for my own personal, I just, feel like, uh, it's going to further put these workers, they're not going to be as connected. They're not going to be able to listen to this types of health messaging, and it's going to put them further at risk. And they're already doing these dangerous jobs. And it's sad and it's scary that, we're now going to force them further underground, and they're not, they're, like, just like in the pandemic, they're going to be at a heightened risk with less safety barriers because of this.
What I'll add, what I've been thinking about a lot is we're really, at this decision point, inflection point for the culture, for the country, and it's like, it's really about this worldview. When we think about a worldview for, the people who are, helping to raise our children, who are helping to grow our food, who are building our homes, who are our neighbors, our friends, our family members, who are us, some of us on the call who come from these histories, and what is our vision for this world and for this society? Is it okay for some people to be treated in such a way? And, the only vision that we have for folks are as these people to fill up prison cells, or do we have something deeper? And I think about the words of Asada Shakur, at this time, and really, where she says part of being revolutionary is creating a vision that is more humane, that is more fun too, that is more loving, that is really working to create something beautiful. And that's really what we're asking for, a world where people can have dignity, where people can be cared for, who are serving these essential, these essential workers, essential to the lives that we live. I think it's all connected. And the thing about climate change, it is, some people are disproportionately affected, but we all are, and climate change is a known driver of both internal and external migration. And we see, when we think of, we're talking about LA, but we look about the major fires in LA, or, earlier this year, people were displaced and will never go back. We look at Florida. I lived and trained in Florida, South Florida, and we see people are, maps are being changed all the time. And so I think it's just also just understanding that too, and what is our vision for the world? Is it a world of scarcity and inhumanity, or is it something more aligned with these, American values that we promote so much, about life, liberty, and the pursuit of happiness? Like, these are the questions that we need to ask ourselves in this moment and in public health. What is our place in this, in this vision for the world? Like, are we just reporting on the carnage, or are we helping to prevent, and promote, prevent suffering, and to promote health, and to, show up in these ways to raise awareness and advocate and be a part of it, versus just, uh, observers from afar reporting out on what's happening, because we're being impacted too.
Great, a wonderful answer. Bashar, I think next one. So what are some challenges you have experienced when addressing people who identify as part of the Make America Healthy Again community, and how have you addressed them?
I can start. In some of the conversations we've had, I'll preface it, but I haven't had direct interactions with folks who have claimed, to be part of this MAHA movement. But I do have experience working with folks across difference and understanding. I think one of the biggest challenges that we face is that people are convinced that there is this kind of binary either or thing, like it's a us versus them thinking, that these arguments that are being made are coming from a malicious place. So just really for me, it's about, for whether we're talking about something that's politicized, that is political inherently, or something that has been weaponized. It's really about identifying what are people, how.
I kind of liked where Julian was going, and if I can jump in, um, we like to think that everyone is a person, everyone has feelings. There's this beautiful quote from Maya Angelou that I often refer to, which is, people forget what you said, people will forget what you did, but people won't forget how you made them feel. Something to that. Don't quote me exactly. It's her quote. And so to that, I would say, even those who follow the MAHA movement, I would say that they still have values that resonate with them. And I would go back to the start point of the three I talked about earlier, which is health, safety, and prosperity. Everyone is concerned about economic prosperity. They want to save dollars. They don't want to keep spending money on climate disasters or healthcare bills. People want to feel safe in their home. They don't want to be threatened by hurricanes or tornadoes or whatever, have wildfires. They want that sense of the security, that sense of community. And of course, they want their health, especially for themselves, and be able to access the health care today, but also create the future for their children and grandchildren tomorrow, so they can also live healthy lives. So I would say a strategy to speak to people who may not be ideologically aligned with you is to really listen to their values. You will be surprised how many entry points there are into a conversation once you understand what motivates them.
I guess, one thing I've tried to do, and I don't know if this is a bad tactic or not, especially around the area of climate change, is don't mention climate change. Whether a wildfire is caused because of climate change, exacerbated by it, it doesn't really matter. Here are the protections against wildfire smoke. Here's what you should be doing at a personal level. Same thing with heat stress. You need to drink plenty of water before you get on the job. If you're on the job, these are, a work rest cycle, etc. And I don't know, maybe that could be a poor way of thinking it, but I guess I've tried avoidance a lot with some of these and just bring it back to the issue that is going to affect them, either, wildfire smoke, heat stress, etc. And, I guess maybe I'm doing a disservice long term, but I guess at least short term, I am giving them the information they need to protect themselves in the moment.
Can I just add to what you just said around the long game versus the short game? Oftentimes we think of messaging and communications as unidirectional and a point in time. But when you're really building community and a rapport with someone, it's multiple conversations. So maybe in the first conversation you have with someone, you just explain, oh, wildfire smoke is really impacting the air quality, which means like my child with asthma, I'm gonna have to make sure that they stay indoors a little bit more, whatever have you. Do you have children? The next time you meet, maybe you can say, there's another, we're still feeling the implications of the wildfire smoke and the asthma, et cetera. And, I've noticed this happening more because of climate change. So every time you talk to someone, right, you can build on it and we bring them along with us. And so there is a long game in here, but also I like the immediate short term. We want to make sure people have the information they need to protect themselves and their families and their loved ones. And there's also a responsibility for us as public health professionals to also build on people's knowledge and understanding and the connectivity to climate change, but also other structures and systems of oppression.
So as I say, I guess it's to your point, it's hard to build a coalition if you already alienate someone in the immediate short term. So I really like that strategy of starting small, hopefully kind of building a coalition, slowly, and then become a much more trusted partner to maybe talk about more complex and politically sensitive topics like that. So it looks like we have about 15 minutes left. I want to get to, I believe we have 2 more questions. So here we go. It says, we've worked around the country on how beloved community festivals can be integral as part of experiential learning classrooms and community resilience and disaster preparedness with performing.
Yeah, it looks like a bit of that got cut off, so I'll just chime in right here.
Okay.
So this question in particular is wondering if your work, you have seen some interesting examples of how arts and cultural workers or venues have been important in not just communications, but also in the ground operations in climate or public health campaigns.
Maybe I'll start. I can't speak to arts events per se, but community events in general are great places for public health interventions and campaigns, and I think climate conversations as well. And it's in part for some of the reasons that Cerulli was talking about earlier, that people want to be engaged in these conversations in places where they have a sense of belonging, right? So they are around other people who they have some connections with. Leveraging those connections, I think, can be really helpful for having some of these conversations, building community and coalitions, and learning and then mobilizing to do something about it, right? So that can be arts events. It can be, community cookouts. It can be events at places of worship. Wherever people are gathering, I think those are opportunities to have these broader conversations.
Yeah, wholeheartedly agree with that response. And just to add in, oftentimes arts, performing, visual, either, both are meant to evoke an emotion. And there's that vulnerability once again when we're connecting with people about at the somatic level almost, and bringing them in, inviting them into conversations. And there are pockets of the country I've seen, and being in Washington, D.C., have seen exhibits around climate and the way they've been displayed in culturally relevant ways, but also through generations, and how different generations are looking at climate as a crisis versus as hope.
If I could add to this, I went to an NIH conference a couple of years ago, and they had on display, it was in New Mexico, and they had indigenous people's artwork about uranium mining and how it affected their lives. And, I'll definitely say I'm not a major art connoisseur, but I really thought that was more powerful than pictures or studies. And it really did evoke emotions. And I think that could be a wonderful avenue to communicate, how climate change is really affecting people. So I think that was a great question that was asked. And I do think that can provoke emotions, which we've learned from our communication side. Evoking emotions do lead to change. So it just could be another avenue. Yeah, go ahead.
So, yeah, if I can jump back in, you reminded me of one other example. There's an artist in Miami, Xavier Cortada, who is doing this artwork around communicating sea level rise. Different parts of Miami, like Miami is one of the places, of course, at great risk for rising sea levels. Xavier's foundation works with schools and other organizations to sort of do these art projects in which they're installing these art installations that make it clear what the sea level is of that particular place. And that spurs some conversations around it. So it's bringing community together to learn about this, but also then thinking about what they might end up doing as a result of the fact that different parts of that city are at different levels of vulnerability. So that's another example of using art to have these conversations.
Bashar, I think we have one more question. Okay, so this is about misinformation and the role of public health agencies and institutions play in correcting misinformation and also being proactive about communications and community engagement.
Maybe I'll jump in here to start. Sharing correct information is one of the best things that you can do proactively, right? So one challenge in the misinformation space is, and this came up I think in the beginning with your remarks, Brian, that people trying to respond to some of it so rapidly, one of the things you inadvertently do in some of that is repeating the misinformation. And the repeating it makes things worse, right? The more times people are exposed to something, the more it sort of sticks as truth, even if it's false, right? So in the literature, we talk about this as the illusory truth effect. Like people just hearing something over and over again makes it feel more true, even if it's not. And so, as health departments, just sharing what is true and repeating that over and over again is one proactive strategy that can be taken. So, if nothing else, just don't repeat and amplify the misinformation, and that will also go a long way.
1000%. Don't repeat a narrative or a message you don't want people to hold on to, because they will hold on to what you said. They might not remember if it's true or wrong or real. Another thing that I would add to the answer is the messenger matters. And so as you're dispelling misinformation or disinformation, consider who's speaking to whom, right? Your community engagement work may include some culturally relevant understanding or approaches. And with that, the messenger should also be ready to deliver. Also consider the platform you're sharing information on. I know we talked about social media earlier, and that might spiral. So combating misinformation, disinformation is often done really well when it's one-to-one. And never underestimate the power of your voice as public health leaders, because you are a trusted entity. Doctors, nurses, clinicians, pharmacists are all people that folks go to for advice. And so this is another area that you can offer some clarification on questions they might have or information that they're hearing that's frankly wrong.
I'd like to add that sometimes we're told to not repeat things, but as a core function of public health, we do have to communicate effectively. And repeating saying false information, and there is a difference between misinformation, like something incorrect, and disinformation, which is more aligned with propaganda, with that's been drafted for some political means. And we have to really understand the difference between, some folks just may be misinformed, but some people are actively trying to change people for political means. And as public health professionals, one of our greatest tools is the rhetoric that we use. How consistently we are repeating our messaging, putting out the real messaging, and really making sure that folks understand and to build an awareness. It's a slippery slope, but I would say that not everything should be ignored. Some vicious lies and other things must be countered with consistent, broad messaging to correct the narrative. But it is a slippery slope, because sometimes messages are have a negative, or designed to bring about or elicit a negative response, and folks are often looking for a fight. And engaging can can provide validity. So it is a slippery slope, but just want to warn us, really, sometimes you have to counter these things and understanding where it's coming from, because often people who share misinformation or information that may be incorrect, but not kind of more propagandistic, those folks are actually coming from a good place. Some folks maybe actually be trying to share a message, a safety concern that sounds valid to them. So just wanted to flag that also as a consideration.
Great. Thank you so much. Bashar, did you have any closing remarks?
No, I think if the panel would like to give any final remarks before we wrap up, and then we can wrap up. Thank you.
Oh, I just want to say this was super lively, informative. I guess my biggest takeaway as a non-communication expert is coalition building is key. Obviously, as a trusted health professional, we can go out and promote certain messaging, but it can be reinforced by a good, strong coalition. Also, in terms of messaging, we have both near and long-term goals, and those do overlap. And maybe we can craft messaging in the near term that gets people on board with the overall, I guess, tenure of the conversation, and gain trust. And then over long term, we can start, talking about more politically sensitive messaging in there. But we first need to engage in, I think, short-term type messaging. Anything else anyone wants to add? I know this is an hour and a half conversation. I don't know if I'm distilling it all down in a couple minutes.
Well, one thing I want to add, which builds on something else that's really said earlier, was a reminder that these are repeated conversations, right? It's very unlikely you're going to find the perfect message that you only have to say one time and like that will solve all the problem. That is an unrealistic expectation, and you shouldn't even try to do that. You're going to need to have multiple conversations with people over time. That's how this works. And so just remember that it is a repeated interaction, and approach it with that.
Yeah, and to build off of that, is to say that there is a lot of value in listening to people so you can hear where they're coming from. Oftentimes, as messengers or communicators, we come in with an agenda. We have to put this message out there. We have to communicate. But when you're doing that bi-directional type conversation and messaging and iterating, it's often helpful to listen to what the person you're speaking to or the group you're speaking to cares about most, and then find a way to make what you want to say relevant to them and make it so that it matters and that enough for them to take action or enough to go back and learn more about the topic.
Finally, I just share that when we think about communication, it's not this flat one size fits all thing. I think about it in the way that we communicate and talk with people. People should be able to see themselves in the work, and how we're communicating. People should be able to see themselves as part of the solution. People should be able to see themselves as these interventions, the things that we're messaging are for them, and that there's some way that this can influence or make their lives better or their communities safer. But we also have to really, I think, as folks have shared, really find a place to listen and come with humility that we don't have all the answers, and that we have a lot to learn from folks in the community. And though folks may not connect these dots directly, a lot of folks have been doing a lot of work responding to climate change and haven't even known that this was actually the result of a climate change issue. I think, I think to end it, I would say, there's a lot of amazing work and that's being done, organization and strategy that's happening. And that's a big part of the story too. So don't let the narrative that the world is on fire and that everything's going to end. There's something else bigger and better. And we're seeing that attitudes are changing and we can be a part of this bigger movement to get the messaging right, and help people understand that science, as one of the chat questions in the chat, that science is this evolving thing. And it's a tool that's brought us many ways. It's not perfect, but we can all be a part of contributing to it. And the science can reflect the community values that we're all bringing to this. And it's a great opportunity for us to do that. And it's conversations like this and partnerships like we all have that can really help be a part of building this growing understanding and this bigger community. So just thanks for everyone for the conversation. Really appreciate it.
Thank you. And on behalf of the PRI, I want to thank the panelists. This was a lively and really engaging discussion. I want to thank everyone else for tuning in, sending questions. Bashar, did you have anything else to wrap up?
No, thank you all for attending. We hope to have one more of these, so stay tuned in the future. But check updates at pri.nyc and follow us on all socials. Thank you for attending, everyone.